my name is Vishali and today I am your nurse. I am here for your head to toe assessment just to know your current health status as per doctor advice. Is it okay for you?
Yes.
Okay, before that may I know your name and date of birth please?
I'm Harsimran Kaur. My date of birth is 21st January 2003.
Okay, can I have your wristband? Yes, it's same to my document, and before that I just want to maintain privacy and dignity of yours, and I will maintain hand hygiene. And now I'm going to ask you a few questions. Do you have any pain?
Yes, I have headache.
Okay, what kind of pain do you have, like quality?
It's like shooting pain.
Okay, what thing make your pain worse?
Watching TV for a long time?
Okay, is it radiating?
No.
Okay, on the scale of 0 to 10, 0 means no pain and 10 means worse pain, how much score would you like to give?
Maybe 3.
Okay, for how long it lasts?
30 minutes to 1 hour?
Okay, do you take any medications for that?
No.
Okay, what do you understand by your pain? Do you know something like why it occurs and how it subsides? And
Yeah, like when I work for a long time on my mobile phone or like laptop,
Okay.
watching screen mainly, then it like happens. When I take a nap, it subsides.
Okay, now I'm done with the identifications and pain assessment. Now I'm moving towards neurological assessment and starting with the level of consciousness. Do you know where are you?
Yes, I'm in Brampton.
Okay, you know what year it is?
It's 2023.
Who is the Prime Minister of Canada?
Justin Trudeau.
Okay, my patient is fully conscious and oriented to time, place and person. Now I'm going to assess cranial nerve 3, 4, 6 and 7. That is oculomotor, trochlear, abducens and facial nerve. As these first 3 nerves help in the eye movement such as eye blinking, back and forth movements, and facial nerve helps in the expressions. So I'm going to assess all these 4 one by one. Okay, you just have to follow some instruction. You have no need to move your head. You just move your eyes as I'm moving my pen.
Okay.
Are you comfortable?
Yes.
Okay. Okay, perfect. As I assess, I have find that there is no involuntary eye movements. Now I'm going to assess facial nerve. Can you please smile for me? Can you frown? Can you squeeze your eyes? Can you back and forth like that? Okay, perfect. It showed that my patient is having no involuntary movements, or the patient is not having any kind of facial expression problems. Now I'm going to assess Perla. Initially I'm going to start with the size of pupil. As I'm going to assess the size of pupil, you have to just stare here. Perfect. Okay, now I'm going to show some light on your pupil just to see the reactivity of pupil towards light. Just same, you have to stare at my nose tip, and I'm going to show some light, and I'm using my cell phone for that. Okay, yes, and now for one more time, you just have to stare at this. Okay, perfect. It shows that my patient pupil is equally round and reactive to light and accommodating. Now I'm going to check confrontation visual field test. For that, you just need more following instructions of mine. Like you have to cover your one eye, and I'm also going to cover my eye, and I'm showing you my fingers, and you just have to tell how much numbers I'm showing to you without staring at my fingers. Are you understood? Are you comfortable? Okay, perfect. Just cover your one eye. Okay, how much it is?
1, 2,
Okay,
3.
perfect. Now for the other.
1, 2, 3.
Okay, my patient confrontation visual field test is normal. Now I'm moving toward respiratory assessment. Initially, I'm going to inspect my patient's chest. Can you take a deep breath for me? One more time. It shows that my patient chest expansion and retraction is symmetrical on both sides. There is no respiratory distress, and my patient is not having any kind of breathing abnormality. Do you have any pain while breathing?
No.
And the pattern of breathing is non-labored. And now I'm going to auscultate my patient chest and anteriorly and posteriorly, and with their landmarks. Anteriorly there are only 10 landmarks, and posteriorly I'm going to auscultate 16 landmarks one by one in zigzag manner. Are you comfortable?
Yes.
Okay, can you do like that? Okay, perfect. Now I'm moving toward posteriorly auscultation. Okay. Please sit comfortably. Perfect. Please be comfortable. I auscultate 10 anterior landmarks and 16 posterior landmarks, and I didn't find any abnormal breath sounds, adventitious cardiac or breath sounds such as fine crackles, wheeze, stridor. Now I'm moving towards cardiac auscultation. For that I'm going to auscultate 5 heart valves and with their landmarks, and I'm going to tell you landmarks as well. Initially, I am going to start with the aortic wall. It's in the second intercostal space, right sternal border. Now pulmonic, left sternal border, second intercostal space. Third intercostal space, Erb's point, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And the fifth one is mitral wall, mid clavicular line, fifth intercostal space, and here I'm going to auscultate apical pulse for 30 seconds. Okay, my patient apical pulse is 78 beat per minute, and the rhythm is regular, and there is no adventitious heart sound. Now I'm moving towards abdominal assessment. Can you please lay down for me? Last time, can you please tell me last time when you voided?
2 hours ago.
And bowel movement?
In the morning.
Okay, now I'm going to inspect my patient abdomen, but for that I'm moving towards the foot end of my patient bed. Okay, in inspection I find that my patient abdomen counter is flat and symmetrical on both sides. There is no swelling, distension, redness and rashes. Even there is no surgical marks present on my patient abdomen. There is no lumps, bumps and bruises. Now I'm going to auscultate my patient abdomen in a proper manner. Like I'll start with the right lower quadrant, right upper quadrant, left upper and then left lower. I'm going to auscultate. I find that my patient is having bowel movements and there is not hyper or hypo activity of bowel movements. Okay, perfect. Now I'm going to do light palpitation. If you feel any kind of pain, please let me know. Do you have any pain? While okay, my patient is not having any kind of lumps, bumps, bruises, nodes. There is no rashes and there is no distension as well. Now I'm going towards assessment of extremity and integumentary. Can you please sit down for me? Thank you. Now I'm going to inspect my patient's upper and lower extremity. Okay, do you have any pain? Can you please show me your hand? Okay, can you just show me your foot? Okay. Okay, my patient is not having any kind of pain, deformity, pressure areas, bruises and not any kind of pain. So I'm moving towards assessment of nails for the consistency and for the capillary refill. Initially I'm going to start with the hand nail. Okay, now foot. Okay, for the nails for consistency, my patient is not having any clubbing nails and consistency is normal and capillary refill rate is less than 2 to 3 seconds, which is normal rate. And now I'm going to palpate radial pulse bilaterally. Yes, it's regular and the strength is 2+. It's equal on both sides. Now I'm going to palpate posterior tibial. Yes, the strength is 2+ and it's regular on both sides. Now I'm going to palpate dorsal pedis. Same strength is 2+ and regular and equal on both sides. Now I'm going to assess circulation. As my patient looks pink in color, nails, feet and upper and lower extremity both, it shows that circulation is going on. By touching I can say that my patient is warm. And for the movements, can you just do like that and do like that? Do you have any pain? Can you push? Can you resist? Can you push? Okay. Can you move your foot? Do you have any kind of pain during movements? Okay, my patient is not having any kind of pain in movements. Now I'm going to assess sensation. Can you please close your eyes? Do you feel?
Yes.
Do you feel?
Yes.
Here?
Yes.
Here?
Yes.
Okay, perfect. Okay, is it pinpointed or dull pain?
Dull.
Okay. Okay, open your eyes. Now I'm going to assess skin integrity and skin turgor. As I can see that my patient's skin is intact, integrity is maintained, and for the skin turgor, as my patient's skin going back faster, it shows that my patient's skin turgor is perfect and my patient is fully hydrated. There is no sign of dehydration. And after completing this assessment, I am going to do documentation after hand hygiene. Thank you. Can you just please show the post video recording? Thank you.